The use of deliberate heat exposure can be a very powerful way to improve health and longevity. Several papers clearly demonstrate that regular use of sauna or other forms of deliberate heat exposure can reduce mortality to cardiovascular events, but also to other events, things like stroke. The more often that people do sauna, the better their health is and the lower the likelihood they will die from some sort of cardiovascular event. One study in particular discovered certain forms of deliberate heat exposure using sauna can stimulate very large increases in growth hormone output, which for people in their 30s, 40s, and beyond could be very useful and may also be useful for people who are just trying to stimulate the release of more growth hormone in order to, for instance, recover from exercise or stimulate fat loss or muscle growth or repair of a particular injury. Subjects that did this experienced 16-fold increases in growth hormone. So they measured growth hormone before the sauna and after the sauna, and growth hormone levels went up 16-fold. What does this mean and why does this happen? Growth hormone impacts metabolism and growth of cells and tissues of the body. It is responsible for tissue repair as well, and may also be useful for people who are just trying to stimulate the release of more growth hormone in order to, for instance, recover from exercise or stimulate fat loss or muscle growth or repair of a particular injury. Now, what do we mean by sauna? We need to define some of the parameters around sauna. The temperature ranges that were used in this study and pretty much all the studies that I'm going to talk about are between 80 degrees Celsius, meaning 176 degrees Fahrenheit, and 100 degrees Celsius, meaning 212 degrees Fahrenheit. Now, how long were people exposing themselves to these hot environments? Anywhere from 5 to 20 minutes per session. Very brief periods of just 5 minutes of heat exposure can be a powerful stimulus if the heat exposure is significantly great enough for you. And in every case, regular exposure to sauna, starting at about 2 or 3 times per week, all the way up to 7 times per week, greatly improves longevity in the sense that people are less likely to die of cardiovascular events and other things that kill us. So the question is, how are you heating up your environment? And I realize that there are dry saunas, there are steam saunas, there are infrared saunas, there are hot tubs, and there are simply rooms that you crank up the heat. Okay, so just to be clear, the temperature range is important. You want to get between 80 and 100 degrees Celsius. You could, however, immerse yourself in a hot tub or hot water bath up to your neck. That's another way to approach it. If you didn't have access to either of those, you could also put on a hoodie or a wool hat and a hoodie, or you could do like the wrestlers do, and you could actually buy one of these plastic suits. They're literally called plastics that wrestlers or other athletes that wish to drop water weight will wear and then go jogging in that. All of those will increase your shell and your core body temperature. So which tool, right? Which sauna, which stimulus do you run in wearing plastics and a hoodie and a wool hat? Do you get into a sauna? That's going to depend a lot on your circumstances, your budget, and what you have access to on a regular basis. What I've tried to do today is to illustrate the general mechanisms by which heat in particular can activate certain biological pathways so that you can devise protocols that are going to be optimal for you and your needs. It stands to reason that for those of you interested in the general health effects of sauna, about an hour per week broken up into 3 sessions makes the most sense based on my read of the data. And again, that range of 80 to 100 degrees Celsius is going to be your guide.